If I was a new nurse, these are the top 3 things that I would focus on to help protect my license and inadvertently make me more money. The first thing, I would become a subject matter expert in my given specialty. So if they put you on med-surg, they put you on tele, they put you in the ICU, they put you down in the ER, in the first 6 months, what I would focus on is knowing the top 10 to 20 diagnoses or most popular diagnoses that I see coming on my unit or my floor, the top 10 to 20 medications that I'm giving these patients every day or every shift I go in, and the top 10 to 20 tests and procedures I'm either drawing on my patients, sending my patient to, or bringing them to. All right. The second thing that I would focus on is getting good with assessment, in addition to critical thinking skills. When you're a new nurse, what the other nurses have on you is time, experience. They've just been there longer, right? A good way for you to even the playing field is to know your specialty inside and out, okay? And then know how to assess your patient full head to toe and focus assessment effectively and efficiently. This is something you can do on your own, right? You're spending a lot of time with the patients anyway. Might as well get good at figuring out what's going on with them from, head to toe. The third thing that I would focus on is my charting. Knowing that charting system inside and out and knowing how to chart like a boss. That's what I would do, okay? This one, I'm gonna link it down here. It's a documentation guide for nurses from Nurse Naja. I think this is an excellent guide for a new nurse or an existing nurse on how to get really good at charting. And then she does go over some other things that are directly related to assessment, right? How good your assessment is going to also dictate how good your charting is. And one of the best things you can do for your nursing license is make sure you chart right the first time. You don't want them people coming back with a depo 5 years later when you can't even remember the patients you had 3 shifts ago. That doesn't make no sense. If you have more questions or any further comments, put them down in the comments below.